Hi, Dalia. Thank you for joining. Who else is online so that I can tell you hi? Okay, we shall start with the class today. Thank you so much for joining, whoever has joined. I hope that whoever has given their BSc nursing exams, because I had offline students here before. So one of my students said that she's giving her BSc exams, first, second, and third year exams, all being on different days. I hope those exams went well for you all. When I actually saw the amount of content that you guys have to read, it's almost equivalent to what we do as MBBS students. Okay, so quite a lot to study. So I'm hoping that you all have done your exams really well. Okay, and anyways, जो हुआ सो हो गया. All the best for your results. I hope that all of you pass with flying colors. So we'll get back into the subject today. So yesterday we finished the portosystemic, like portal hypertension, right? So I'll go back to the topic again. I'll show you how transjugular intrahepatic anastomosis tips. I was saying a shunt. There is a shunt. But I'll just show you how it looks like. Okay. So, firstly, going to the feces again. Let's talk a little bit about the poop. Okay. So I was saying the brown poop is dark yellow to brown poop is kind of like normal. It's not exactly brown, it's like dark yellow, mustard color. And that pigment is because of urobilinogen. Okay, that is a byproduct of the bile. And green you can see here. Okay, that is abnormal again. Hmm? Yellow, very light yellow is again abnormal. Black, I was telling you yesterday, it's melena. Okay, melena. Black, tarry, sticky stools. This is white or clay colored stool. This kind of yellow, imagine more lighter shade of yellow, and they kind of float in the water if the person has used in, let's imagine he has used a western toilet. You can see over the water it actually kind of floats because of excess amount of fat. What happens if you add oil to water? All that oil will come and stand above the water, right? Same thing happens whenever there is excessive fat content in the feces. Why does it happen? Because whatever fat you have consumed has not been absorbed by the body, neither it has been digested by the body. Okay, it's not been metabolized. So all that has to come out one way or the other. No? So they'll all end up coming out through your feces. And all that is like kind of a sticky, light yellowish, very foul smelling stool with excessive fat content in it. It is called steatoria. It's called steatoria. Okay. That is what is this kind of very light colored yellow stool which floats in the water because of excessive fat content in it. It's called steatoria, and this happens whenever bile, which is very important for your fat metabolism, is not being secreted into your duodenum. So whenever that bile doesn't come through the bile duct, or if there's any kind of obstruction in your gallbladder tract, whether it is cystic duct or whether it is common bile duct, where if ampulla of Vater has any kind of obstruction because of stones, that bile is not getting produced. Okay, it is not being excreted into the duodenum. And if it is not being allowed to come into the duodenum, that food which has excessive fat content is not utilizing that bile. Okay, it's not unable to utilize that bile. So whatever fat is there in that food will get digested, will not get digested and will come out through your feces, and that kind of feces is called steatoria. This red color kind of stool is called hematochezia. Hematochezia, okay. And this is the clay colored stool. You have it in obstructive jaundice where bile overall is not produced. Okay, so there is no color at all to the stool. It will look like clay. It will look like multani mitti. Sorry. So this is hematochezia, and this black stool, Ivala na black stool, it is called melena. Okay, this is hematochezia because frank blood matlab fresh blood, especially in hemorrhoids or any kind of pathologies in your rectum or in your sigmoid colon if they're there, and immediately the stool is coming out at the anal area if you have any kind of fissures. Fissures are like cuts. So whenever the feces is trying to pass through the anal aperture, it will cause more friction and more bleeding can occur because of stretch. Okay, some blood vessels can break. Frank bleeding can occur. That's called hematochezia. And melena usually occurs whenever there is upper GI bleed. Upper GI matlab upper above the stomach. Okay. So coming back to portal hypertension management, I already told you that you're using certain drugs to decrease the bleeding, especially at the esophageal varices area, at the lower esophagus, wherever you have the dilated veins like esophageal varices. To reduce bleeding at that area, you are using vasopressin or somatostatin or octreotide. Hmm. And then you can also do balloon tamponade. I've showed you one tube amongst it. Just a second. Let me close this door. It's turning very, very hot. It's been very hot since 2 to 3 days. That's why I've been taking classes in the evening because at 3 o'clock it is like really hot. For any of you to listen to class or for me to come down to the class and teach you. So, portal hypertension management. I've spoken about Sengstake Blakemore tube. I told you that it has three openings, like three tubes. I'll show you one nice picture. It's a comparison between three different kind of tubes used as a tamponade. Okay. In Sengstake Blakemore, you have two balloons: esophageal, gastric balloon. Yesterday I've told you, and that esophageal balloon is what which is dilated with air to cause a pressure over those bleeding varices to attain hemostasis. Endoscopic sclerotherapy, you are injecting the sclerosing agent into the bleeding varices to promote healing. Esophageal banding you can do. Everybody, I think you'd have seen how do you do a tubectomy, right? Uh, Tube का banding करते हैं ना. So in many of the OTs, especially or gynec OTs, post delivery, you tell many of the women you encourage this kind of a procedure so that if they had any kind of issues in the previous pregnancy, it doesn't happen again. First of all, they don't fall pregnant again. Okay, so in that people you will do tubal banding or tubal ligation. That band like thing, you know, it's a dikta, it's a round like small rubber band it will look. Even that can be used. This banding, वैसे ही दिखता है varicose banding. You just put a rubber band, the patconi, you just put a rubber band around it, and that can undergo necrosis. That bleeding varices will undergo necrosis and finally stop bleeding. So I was talking about transjugular intrahepatic portosystemic shunt. इसका मतलब क्या है? So there is portal hypertension. मतलब there is some kind of obstruction in the liver. Okay, blood is unable to reach the hepatic veins. It's unable to go into the hepatic veins. Finally, these hepatic veins have to drain into your vena cava, the superior vena cava. So that is not happening. So what are we supposed to do? We're supposed to cause a direct shunting, direct kind of a tubal shunting from the portal vein to the hepatic vein directly. Okay. So that is what is called tips. That also can be done. It has varied its own disadvantages, but we'll not discuss about it. Just know what is tips. I'll show you a picture. It's very easy to understand. And then you have surgical management, surgical ligation of the bleeding varices and esophageal transection. So even after doing everything, the bleeding is not getting controlled. You have to save that patient because if that patient keeps continuously bleeding, he'll go into hypovolemic shock. Okay, the volume of the blood decreases, that can end up, so the major organs like your brain and your heart will not receive good amount of blood. If those don't receive good amount of blood, what happens? All the perfusion to the tissue stop. Na? So if the brain is not receiving blood, no oxygen, what will the brain and the person will become brain dead. It will go into shock. No? So if the bleeding is not reducing even after doing everything, you're removing of that part, whichever is notorious for bleeding. Okay. Surgical devascularization is you're causing some kind of a tamponade, like you're stopping that flow of blood towards that particular area. Naturally, bleeding will stop. And then you have surgical bypass procedures. In these procedures, it is to help to drain portal blood and thereby to reduce portal pressure. ये कहाँ भी drain हो सकता है, अलग-अलग चीजें हैं. But just remember, we can also do a bypass here. Splenorenal shunt is nothing but you can cause a shunting from the portal vein to the spleen. That splenic vein is there, can be attached directly to the kidneys. Okay, mesocaval shunt, portocaval shunt. All these are different type of shuntings. This is tips, which is very important. You need to know. Okay, you can see this thing. This is the extra thing which we have added between this hepatic vein, which is flowing out of the liver, and this portal vein, which is coming inside the liver. This liver is damaged. Okay, this liver is damaged. So now we want to see through it that this blood somehow reaches the hepatic vein. The hepatic veins are fine. So you're causing a shunting. You're causing a connection between the portal vein directly from the portal vein and directly opening it in the hepatic vein. So finally, the flow is being, taken care of. So that portal hypertension reduces. Next, coming to shock. Shock में अलग-अलग type of shocks are there. So first of all, you need to know what is shock. Shock is a condition in which systemic blood flow is inadequate. Systemic blood flow means what? Whatever blood the heart pumps to the body parts. Okay, the oxygenated blood which comes out of the heart is inadequate. It is not sufficient to deliver oxygen and nutrients. सही से or the organs are not receiving good amount of blood, especially what are the major organs in this, the brain and your heart. Okay, that's the last stage where you can't come out of it. The patient will enter into coma. Hmm? But before that, in the initial stage, all the peripheral organs and all, they'll firstly peripheral organs mark happy. Okay, all the peripheral, that's why all your peripheries will become cold because you're not receiving good amount of blood. So there's no nutrients, there's no oxygen. Matlab what will happen? You'll have cyanosis, you have bluing. Okay, so once suddenly, if this thing happens suddenly, it's an acute attack. Suddenly everything will go, the whole organ system will go into confusion. Suddenly the peripheries are not receiving blood, and even if the brain and heart also are involved in this, the patient will have suddenly will go into shock. Okay, that is what is shock. That's the meaning of shock. That all the tissues are not receiving proper perfusion. Okay, from the systemic blood. It is an acute medical condition, reduced perfusion to the body tissues. Etiological classification, there are four types. First type is hypovolemic, second type is cardiogenic, third type is circulatory or distributive shock. It's in the name, circulatory or distributive shock. And fourth is the obstructive shock. So this table talks very neatly about it. Okay. So what does it say? First, let's talk about obstructive shock. Occurs when the blood cannot get where it needs to go, as in pulmonary embolism or collapsed lung. If the lung is collapsed or there is some kind of an obstruction in the pulmonary artery, suppose. Okay. The blood, whatever the blood, the venous blood comes, it comes to the right atrium, goes to the right ventricle, comes out to the pulmonary artery, and it has to go to the lungs for purification. If you have any kind of block here, that blood is not going to the lungs, and equally that good amount of that venous blood after purification has to reach the pulmonary veins and finally drain into the left atrium. So that is also not happening. So there is some kind of an obstruction here. That is what is called obstructive shock. Overall, what happens? The systemic blood flow will decrease here. That will lead into obstructive shock because the cause is obstruction here. What is cardiogenic? Cardiogenic, the name itself says some etiology with the heart. Suppose the patient has undergone or he has suffered a heart attack. Okay, what happens in heart attack? There is ischemia or infarction. Infarction is the word. Infarction of the heart muscle wall. So the heart kind of becomes weak. It's not able to pump properly good amount of blood. If left ventricle is damaged, okay, let's assume the left ventricle has undergone a heart attack, infarction. So left ventricle is damaged. So left ventricle is what is involved now, which pushes the blood into the aorta. The wall of the heart has weakened. So what happens? The blood is not, the heart chamber is not able to pump in sufficient blood into the aorta. So there is some kind of a damage to the heart, which is reducing the cardiac output. That is what is leading to decreased systemic circulation. Hence, it is causing cardiogenic shock. Okay. And then coming to distributive shock. What is distributive shock? It occurs when blood vessels become floppy and reduce how much blood reaches the organs, as in anaphylaxis. So, what happens in anaphylaxis? All they undergo vasoconstriction or they become floppy. Like floppy in the sense like moose. The blood vessels don't work properly. Okay, if there is any kind of issue with that, then they develop distribution. So there's a problem in the distribution. You're not able to distribute that. The blood coming out of the heart is very much normal. How much is required? It's coming out. Good amount is coming out, but it is unable to distribute properly to that particular tissues. Okay, if there is any kind of a ghafla in this, then they will develop a distributive shock. And then there is hypovolemic. The name itself says hypovolemia. Matlab, there is reduced amount of volume of the blood. Occurs when there is not enough fluid, that is blood here, circulating throughout the body as in internal or external hemorrhage. So what is happening in esophageal varices? Excessive bleeding is happening now. The patient is vomiting out blood. If there is excessive of vomiting of blood, the volume of the blood in the body decreases. The patient can go into hypovolemic shock. That is what is about hypovolemic shock. Very nicely described. What do you do? This is the first aid. क्या करते हो whenever you have a syncope? Syncope मतलब क्या? Suddenly they'll collapse. What do? You raise both their lower limbs. Na? Why do you do it? Does anybody know? So you do it because your major organs are your brain and heart. You want to push maximum amount of blood towards the brain and the heart. So what you do is gravity plays the thing role here. So you're trying to lift the lower limbs so that any blood which is in the lower limbs finally comes center towards the center so that the heart can pump equal good amount of blood to the brain because we don't want the major organs to have any kind of damage. Okay, we have to save them first. So you will raise both the lower limbs up. All that blood which is in the periphery now it will enter into the heart, and finally the brain will start receiving good amount of blood, and the patient will come back into the consciousness. This is actually what you do for people who develop syncopal attacks. It just collapse suddenly. So you keep the patient flat on the back to increase circulation. You'll raise their limbs 8 to 12 inches to provide blood to the heart and brain, okay, without affecting the breathing. You can cover the patient with blanket to maintain body temperature because all the peripheries will become cold in shock or in syncopal attacks. So you have to cover the patient with a blanket. Okay, consider injuries. If there is any kind of neck injuries or spinal injuries, don't cause more of movement. If you cause movement, then you might end up damaging major nerves. Okay, so be careful. You shouldn't have any kind of injuries because what happens once a patient takes a fall, he can fall down from a very big height, having a spinal injury or head injury. All these things can occur. Neck injury can occur. So you have to first assess that whether any kind of injuries are there. If the patient has just fallen from a very small height and you're just there, you're able to catch the patient. You make them lie down and you position them in this shock position. This is called a shock position. Okay. So you can see here the lower limbs are elevated to 8 to 12 inches. ठीक है? इसको elevate करते हैं. You push all the blood towards the heart, and that blood again it's taken back to major organ, that's your brain, so that you regain your consciousness. This is the first aid you can do because you cannot put an IV line immediately if the patient is somewhere on the road or if the patient is at your home where you don't have all this available. So you're supposed to do this basic first aid. Everybody needs to know this is very important. Next, coming back to those tubes which I was talking about, just remember three tubes. Pehla I have told you about Senstaken Blakemore tube. Second is Minnesota tube. Third is Linton tube. Okay, I'll show you the picture. So what? Uh, so these are the three tubes here. A, you can see the first tube. This tube here is Sengstaken Blakemore. Okay, B, this tube here is Minnesota, and this tube here is Linton. What is the difference here is, let's take Linton first. Linton में क्या होता है? You have दो ट्यूब रहते हैं. One is to inflate air into this gastric balloon. So we don't have an esophageal balloon in the Linton tube. We only have gastric balloon. And also you have one port through which you can aspirate. Okay, you can remove of any kind of excessive fluid in that area. Okay. So this is the only two tubes available in the Linton, and then you have a gastric balloon here. You don't have an esophageal balloon. This is Linton. B. Minnesota, differences between this Blakesmore and Minnesota is Blakesmore may you have three tubes here, very clearly visible, and Minnesota may you have four tubes. So Blakemore में क्या रहता है? One tube is to inflate the esophageal balloon. Second tube is to inflate the gastric balloon, and third tube is for gastric aspiration. Okay. Third tube is for gastric aspiration. So gastric, can you see yellow? Gastric aspiration, okay, gastric balloon inflation, and then you have esophageal balloon inflation. Then यहाँ पे your four tubes. You have gastric aspiration, you have esophageal aspiration, then you have gastric oh god, inflation, then you have esophageal balloon inflation. So in Blixmore, you have one port for inflating the gastric balloon, second port to inflate the esophageal balloon, and the third port is to aspirate from the gastric area, not the esophageal area. But in Minnesota, you have one for inflating the gastric balloon, second for inflating the esophageal balloon, third for gastric aspiration, and fourth for esophageal aspiration. Just remember this. That is what is about the tubes. Saints taken Blakemore, Minnesota, and Lincoln. So coming back to this slide, Sengstake Blakemore has three lumens: ports for gastric and esophageal balloon and gastric aspiration. Minnesota has four lumens: two for balloon aspirations, esophageal balloon, gastric balloon, and two for aspiration. One is for gastric, one is for esophagus. Okay, and then stomach balloon can be inflated up to 100 to 200 ml of air. So 100 to 200 ml of air you can push. More air can be pushed into the gastric balloon. Just remember that. Okay. X-ray confirms the position of the gastric balloon. And what did I tell you yesterday? The first balloon to inflate is your gastric balloon, but the first balloon to deflate is the esophageal balloon. Then the gastric balloon, after you push air into the gastric balloon, the gastric balloon is pulled against the cardiac part of the stomach to cause any kind of tamponading effect over that area. Irrigation of the tube is done to detect bleeding. Yesterday itself I told you, you can irrigate. Okay. If it is coming out clear, it means the esophageal balloon need not to be dilated. But if, after you irrigate and then after you remove that fluid and check if you have any kind of bleeding in it, it tells us that there is some kind of bleeding varices in the esophagus. That's when you're supposed to inflate even the esophageal balloon. Pressure in the esophageal is 25, gastric is 40. This I told you, pressure in the gastric is more. Once the bleeding varices stop, first esophageal balloon will be deflated. After several hours without bleeding, gastric balloon will be deflated. If several bleeding free hours are there, then the tube is removed. So it is in place. First you will deflate esophagus once the varices bleeding stops, and then you will wait. If there is no bleeding, then you will deflate the gastric balloon. Okay, then you'll keep the tube in there for a long time to wait for several hours after no bleeding episode. Then you'll remove the tube. And coming to liver abscess. So liver abscess can be of two varieties here. One is pyogenic, pus is involved. That is mostly because of bacterial liver abscess. Okay. And second one of the most commonest liver abscess is your amoebic liver abscess. The name itself says everybody knows what amoeba is. It's a shape-shifting protozoa. Okay. So amoeba is what is causing the amoebic liver abscess, and it is the most common type of abscess in the liver. So amoebic abscess is caused by amoeba by the name Entamoeba histolytica. This is the name of the amoeba. This is the name of the amoeba, Entamoeba histolytica. Okay, that is the amoeba which is causing amoebic liver abscess. What are the clinical manifestations? Once you have abscess in your body, any kind of infection, fever, wherever it is present, it will cause pain. So where is your liver? It's in the right upper quadrant, right? That area is where you will develop pain. You can have anorexia. Once you have fever, you do not be able to eat properly, and liver is getting involved here. Bhook kam ho jata hai, hunger spells are gone, patient will become very thin, anorexic, okay. Nausea will be there, vomiting will be there, hepatomegaly, the liver can bulge in size, jaundice can occur. Anything which touches the liver, anything which irritates the liver can cause a bit of jaundice. So this is your amoeba. And this is what is called anchovy. 1 minute, Baba. Anchovy sauce. It's so difficult to write, you know. It is not cooperating with me today. Just Google this anchovy sauce. Sauce is there, no? Not tomato ketchup. Anchovy sauce. That is the color of the anchovy sauce, and that kind of a color comes out from the amoebic liver abscess. Okay, anchovy sauce pus. That is how it looks. It looks like an anchovy sauce. Hence, it is called anchovy sauce pus, and that is seen. It's a typical. It's pathognomonic. Paka paka. If you see this, it's pakka amoebic liver abscess. But if you see yellow kind of pus which is coming out like this, yellow kind of pus which is coming out, then this is a bacterial pyogenic liver abscess. Okay. So if you see a picture like this, you can see one area of liver has undergone damage. All that necrotic area will form pus. Okay. This is a pus-filled cavity, may be caused by an infection or due to illness or trauma. Hmm? And this is a CT scan. You can see here pus collection. How do you know this is CT? You can see bones. Huh? Bones are all like hyperilluminant. They're all white. Okay, so that is why you're calling it as CT. But in MRI, you can't see all this white. It's all like dark. It's slightly grayish or black in color. Hmm? This is abdomen, CT abdomen. So you can see very clearly. All this is liver. All this nice big organ is liver. In that, you're able to see pus. Okay. This is how you drain a pyogenic liver abscess. That's a surgery done. So what in sensate and Blakemore tube में क्या होता है? Sometimes you need to keep an scissors. This is a scissors. You know everybody knows what is scissors. You keep it near the bedside. Why? Because sometimes uh, this tube can migrate. Okay, if it is migrating and it comes till the oropharynx here, it can cause a pressure there. Anything which pressure, any pressure here, what it will compromise your breathing passage. So if there is any kind of pressure on the breathing passage, a patient is unable to breathe, death can occur. So it is life threatening. Just in case any kind of situation happens and where this migrate, you will cut it off. So that deflates and immediate relief comes. That pressure is completely removed. That's why you keep a scissors bedside. So scissors in an emergency article kept bedside that needs to be kept with the client with sensate and Blakemore tube because rupture of a balloon or migration of the balloon to the oropharynx can cause life-threatening airway obstruction and asphyxiation. Coming to hepatic encephalopathy and coma, failed liver cells are unable to. So what happens? Yesterday I told you what are the functions of the liver. So if you don't know, please go back into the app and review the previous class. I have heard from sir that all these are getting uploaded into the app. So please have a look if you have missed those classes, okay? Because of your exams or any kind of work that you're busy with, have a look, okay? So liver may one of the functions is it converts this toxic ammonia, which is being produced by toxins, also from gut bacteria. Gut bacteria produces ammonium and also protein metabolism. Can the byproduct is ammonia. So, what is the work of the liver? All that blood which is coming from the gut is ammonia rich. Okay, it is in the portal vein. That portal vein is carrying all that blood towards the liver for detoxification and for any kind of conversions of these toxins to non-toxic material. So, in that, one of the content is ammonia. Now, this ammonia is being converted to urea by the liver. That is one of the liver's function. Suppose the liver is not able to function, what will happen? It won't be able to convert this ammonia to urea. and that ammonia gets accumulated, which is very toxic for our body. What will happen? It will lead into hepatic encephalopathy. It also goes and damages your brain. Hence, encephalo means your brain is also getting damaged. वहाँ पे भी जाके वो बैठेगा. वहाँ पे भी ammonia will go accumulate in the brain and it will cause encephalopathy. Okay, because of a hepatic cause here, because of failed liver. So failed liver cells which are unable to convert ammonia to urea. As a result, ammonia accumulates in the bloodstream. Hepatic encephalopathy occurs due to accumulation of ammonia, which is toxic to the brain cells and other metabolites in the blood. Hepatic coma is the last fourth stage of hepatic encephalopathy. It's the most advanced stage. Okay, earliest, what is the earliest symptom is you have minor mental changes because it's going and damaging your brain cells. Na? हल्का हल्का सा differences रहता है. Motor disturbances is there. The patient is unable to write properly. Okay, the patient will have something called asterixis. Asterixis means flapping tremors of the hands. Why is it called flapping? Matlab, this is called flapping. So imagine you're telling the patient to keep the hands like this, okay, and asking them to keep it straight like this. Okay, you're holding the hands like this. Suppose imagine you're holding the hand like that. If you are a normal patient, you don't have hepatic encephalopathy, this will stay in place. So once I remove the hand, it is staying in place. But if that patient has hepatoencephalopathy, it will go and fall like this. So again, you try to hold the hand and keep it up like that. Again, it will fall like that. So flapping. Hence, it is called flapping tremors, which is also called as asterixis, which is very much seen in this hepatic encephalopathy cases. They're also unable to do simple tasks like writing. So motor disturbances hai na, they're unable to do simple tasks like even writing. Even that becomes difficult. This is asterixis. So you can see how you are putting the hand up like that, and again the hand falls back. So doctor can check for asterixis by having a person. See if you have any kind of hepatic encephalopathy cases. People who are working, currently working in hospitals, or even if you're not, visit any good government hospitals like Usmania or Gandhi, and you go to the medical ward and you see, ask anybody there, any of your friends who are working in Gandhi Osmania, if they have any kind of hepatic encephalopathy cases, go and appreciate all this. Even we get to see this very rarely, but if you have a case, definitely go do this in them. It will be very fascinating for you to see. I'm sorry, but fascinating is a very wrong word. But as a clinician, it's very you're excited to see this kind of things in your ward, and that will remain in your mind. That pictographic memory will remain in your mind, and you never forget what asterixis is. Okay. Alcoholics तो बहुत सारे हैं, तो एक तो मिलेगा encephalopathy. Go have a look in your wards. Okay, any place wherever you find, wherever you have a medical ward, you can go ask your PGs or any doctors there or any friends of yours whether they have this hepatoencephalopathy cases. Go and appreciate. Okay, so doctor can check for asterixis by having a person stretch their arms straight in front of them and then pull their wrist backwards, like they're stopping traffic. A positive sign is when it will be when involuntarily the flapping movement of the hand upwards. That is called asterixis. Inability to reproduce a simple image is known as constructional apraxia. This is constructional apraxia. So, if I have a hepatic encephalopathy case, I'm drawing this diagram for the patient, the star I'm drawing. And I'm telling the patient, चलो भाई star draw करके दिखाइए please. Okay, मेरी draw chest to instantly. We'll ask the patient to draw it. And this is how he draws. You can see niche, this is drawn by the patient. Okay, he's not able to do simple tasks, he's not able to copy it. Okay, this is called constructional apraxia. That's the term used. So inability to reproduce a simple image is known as constructional apraxia. That is one of the examples. Even if you draw a clock and you write nicely, up if you write 12, here you write 3, you write 6 here, and 9, 1, 2, 3, 4, 5, 6, ऐसा लिखे तो भी दूर दूर लिखे तो भी this patient will not able to. First of all, they can't draw a clear circle, and on top of it, they can't write numbers very clear. They write very nearby to each other. That is also constructional apraxia. One of the examples. Even if you draw a rectangle, they won't be able to draw. Even if you draw any kind of shapes like a nice cube, they won't be able to draw. They won't be able to copy it properly. In the initial stages of hepatic encephalopathy, deep tendon reflexes are all hyperactive. One of the examples of deep tendon reflexes is a knee jerk. So you have this hammer, na, which most of the doctors carry. Have you seen? So when they try to elicit a knee jerk, the leg will go up, na, when you're trying to put on the tendon. So यहाँ पे patella tendon पे when you're trying to hit, it will cause a knee jerk. That's one of the examples of deep tendon reflexes. Initially, all these are hyperactive, but what happens later on is they will worsen. Once the hepatic encephalopathy becomes more and more worst, all these reflexes will disappear because more damage is happening to the nerves. And extreme में everything will become more flaccid, loose as a हो जाता है. You won't be able to elicit any kind of proper tendon reflexes. Then you have something called fetor hepaticus. This sweet, slightly fecal odor coming out of the breath, ammonia breath. We call it as ammonia breath because of excessive of ammonia. You'll have this kind of whenever you dump excessive fruits, okay, into your dustbin. How does the dustbin smell? That kind of smell will come. Okay, that is called fetor hepaticus. What is the management you're doing? Lactulose is administered. You're giving lactulose here. Lactulose binds with ammonia and it safely transfers the ammonia out of the bloodstream, and it sees through it that excessive ammonia is coming out into your feces. Then you have to eliminate protein. Tryptophan, there is one amino acid which causes the end product is ammonia. So you will see through it that the patient takes less amount of proteins because protein metabolism end product is ammonia. So less protein. Okay, more fats, more carbs is okay, but less protein. Administration of neomycin sulfate. I've heard somewhere that this less protein intake is not very much used nowadays, but I don't know. I'll have to find out from my seniors. But just remember, it is one of the things. It is a part of it. Okay, it's part of the management. Then administration of neomycin. Why are you giving the antibiotic? Because all that gut bacteria which is there now, it is causing the conversion to ammonia. So you will kill those gut bacteria also to reduce the ammonia production. Okay. Then jumping to viral hepatitis. What does the name say? It is hepatitis caused by viruses. Everybody knows hepatitis B. Please don't tell me you don't know hepatitis B. Okay. So everybody knows hepatitis B, and I know how much we are scared about hepatitis B or HIV infections. Okay. Or you have to be more extra careful if we have a positive patient with us. That because there is 30% transmission rate. So you have different kind of hepatitis A, B, C, D, and E. The different kind of viruses. In that, hepatitis B virus is the only DNA virus. Remaining all the hepatitis virus A, C, D, and E are RNA viruses. This much you remember. Okay. Hepatitis A and hepatitis E. How do they spread? They spread by fecal-oral route. So if the patient is actually excreting this virus into the feces. So if that feces gets mixed up with your drinking water or get mixed up with your food, transmitted by the houseflies, contamination occurs, and you're eating that kind of food, drinking that kind of water, it can spread. Okay, hepatitis A and hepatitis E. And pregnant ladies with hepatitis E is what you'll see more common. Then you have hepatitis B. It is parenteral. Hepatitis C is also parenteral. Hepatitis D is also parenteral. Remember that hepatitis B matlab dependent. It is dependent on the B virus for its replication. Okay. It wants the cover of the B to survive in our body. So always remember that hepatitis D for donkey or D for Delhi, is never seen alone. Only if that patient is previously affected with hepatitis B, then this hepatitis D can come and survive. If there is no hepatitis B infection in that patient's body and D wants to come, it cannot survive in our body. That much you remember. Okay. Parenteral means it is outside the gut. It's nothing to do with gut. It comes from blood transfusions or spread from any kind of bodily fluids. You have a cut on your hand and you're dealing with a hepatitis positive patient. So that was cut to say if that patient saliva touches you, urine touches you, anything, any bodily fluid touches you, semen, all these things will have those active viruses. They'll enter your body. Okay, that is how the infection comes. How do you manage? एक तो you'll give vitamins. then fat digestion will be affected. So you have to cause some kind of a diet control. Okay, and you'll give antiviral drugs. Antiviral drugs may chala the lot of examples. Big names are then like lamivudine, entrocitabine. Even we find it like very difficult to pronounce. So you have classes of antivirals. Just remember it's a virus, so you're giving antiviral, not antibiotic. Okay. गलती से भी एंटीबायोटिक टिक नहीं करना है, इसमें आप दे रहे हो एंटीवायरल. हेपेटाइटिस ए I told you. Okay. Now coming to all different hepatitis. Hepatitis A is infectious hepatitis. It's RNA. It takes 15 to 45 days. It's its incubation period and spreads through fecal-oral route. Then you have hepatitis B, which is serum hepatitis. It's a DNA virus. The incubation period is 28 to 180 days. It is from parenteral, from serum, from saliva, from semen, from vaginal excretions. Like all these secretions can also, they also have these viruses waiting to spread. Okay. And then you have hepatitis C, which is again RNA virus. I already told you, B is the only, B for Bombay, is the only virus, hepatitis virus, which is DNA. Remaining all the hepatitis ones are RNA. Hepatitis C is again parenteral, 15 to 160 days incubation. Okay, especially it's associated with blood transfusion. Nowadays, even HCV tests have become very common. Na? Not just hepatitis antigen antibody test, HBsAg you say. Na? Other than that, you're also doing HCV. You're doing tests for even hepatitis C. Hepatitis D is an again RNA virus, 28 to 180 days. It is also parenteral. It requires hepatitis B to survive for its replication. It takes the hepatitis B's surface antigen, the cover, for it to replicate. So it is only seen in patients who have already hepatitis B infection. Hepatitis E, E for elephant, is an RNA virus. It is not mentioned here, just remember it is very commonly associated. If you're average, so remember that if you have hepatitis E, you're seeing hepatitis E infections. Remember that it is more commonly seen in pregnant females. It's an RNA virus, 14 to 63 days, incubation period, fecal-oral route. So, what is hepatic cirrhosis? Just a second. Dali, I didn't. That are you answering or you asking a question? I didn't understand. For good blood supply in the brain. You talking about shock? Okay, coming to hepatitis, hepatic cirrhosis. What is cirrhosis? Cirrhosis means the whole liver is completely gone. पूरा gone case हो गया है liver का. पूरा fibrosis हो के liver has completely got damaged. Okay. So replacement of the normal liver tissue with fibrotic tissue that disrupts the normal structure and the function of the liver is what is hepatic cirrhosis. It can be classified as alcoholic cirrhosis. Okay, and then you have post necrotic cirrhosis. Okay, and then you have biliary necrosis, which can lead to which is necrosis just around the biliary tract. So first one is alcoholic cirrhosis, micronodular type. Chronic consumption of alcohol leads to cirrhosis and is the most common type of cirrhosis. Post necrotic cirrhosis is having it's occurring after necrosis. It's due to some kind of an infection or it's due to some kind of an inflammation in the liver. That is what is leading to post-necrotic cirrhosis. It's a macronodular. Okay. Biliary necrosis is scarring around the bile tract as a result of chronic biliary obstruction or infection in the biliary tract. Then you have last one is cardiac. Especially right-sided heart failure can lead to hepatic cirrhosis. So this is your normal liver on your left. This is your normal liver, and this is abnormal, cirrhotic. You can see all these nodules, na? All this nodular thing. That's what we are talking about. Micronodular, macronodular. Okay. What is the incidence? It is twice as common in men as compared to women. So it is more common in men, is what this sentence is trying to tell you. And peak incidence, when do you find it, especially age group of 40 to 60 years में इतने साल 40 साल पीपी के cirrhosis में जाते हैं. Okay, so 40 to 60 is the age at which these patients can develop cirrhosis. Signs and symptoms: anorexia, nausea, vomiting, weight loss, constipation, or diarrhea. Either or you can have. Jaundice is there, liver is getting damaged. Na? Other than that, you can also have hepatic encephalopathy. Complications, it can lead to ascites. All that low albumin can cause water retention. Okay, ascites हो सकता है. Esophageal varices can happen because liver मार खा रहा है. So portal vein which is going inside is unable to go. The blood is unable to reach the hepatic vein. Varices can occur. Portal hypertension can occur because of varices. Because of portal hypertension, varices develop. Then you'll have peripheral edema. Okay. Decreased synthesis of bile also occurs, and it affects the absorption of fat because bile is being produced by hepatic cells. Na? So hepatic cells are getting damaged. Matlab even bile synthesis reduces. It affects the fat soluble vitamins especially. Coagulation abnormalities can also occur. Vitamin K, 2, 7, 9, 10. These are, you should remember these. These are linked to intrinsic pathway. Okay? 7 is linked to extrinsic pathway of coagulation, and 2 belongs to intrinsic pathway. 9 belongs to intrinsic pathway. From 10 you have common pathway. Even if you don't remember, just remember that 2, 7, 9, 10 and vitamin K deficiency can occur if the liver has any kind of issues. So treatment में क्या दे रहे हो? Vitamin K deficiencies है ना? You're giving vitamin K, and then you're giving. Other than this, if there is any kind of excessive acidic fluid accumulation, you're doing paracentesis. Yesterday I told you do it gradually, slowly. You don't do it suddenly. If you do it, vasodilatation can occur and patient will go into shock. You can also do peritoneal-venous shunt. So you're causing a shunt between the peritoneal cavity and the major veins. All that excess fluid will drain into the venous system. Okay. And then other than this, because excessive amount of fluid accumulation is happening, you have to get rid of it through urine. So you'll give a diuretic, especially a potassium sparing diuretic. And then vitamin K you're giving deficiencies there that will reduce the bleeding. Okay, you're giving lactulose to treat hepatic encephalopathy. What does lactulose do? To take away all that excessive ammonia and to push it into the feces, and the feces with that excessive ammonia is excreted out of the body, so toxicity decreases. Or also give vasopressin to treat esophageal varices. Octreotide दे सकते हो, vasopressin दे सकते हो, and you are doing blood transfusion if there is excessive blood loss. These are the treatment of cirrhosis. Okay. Then coming to cholecystitis. Cholecystitis is nothing but inflammation of gallbladder. Most common cause is the stone in the biliary tract. So you have, I told you, right and left hepatic ducts they join to form common hepatic duct. In that, cystic duct, which is the duct coming out of gallbladder, opens up. Both this combine to form common bile duct. Common bile duct, along with pancreatic duct, drain into the ampulla of water, finally opening up or draining into the second part of duodenum, which is a part of the small intestine. So, inflammation of the gallbladder. Cyst, cyst means gallbladder. Okay, itis is inflammation. So, inflammation of gallbladder. Most common causes biliary tract obstruction, which is caused by a gallstone. You also have acalculus. Acalculus matlab no stone involvement. Without the stone, any kind of infection or if there is any kind of gallbladder wall problem, all these things can also lead to cholecystitis. What do you have? What are the symptoms? It's again on the right side, just below your liver. It will cause pain in the right upper quadrant, and it will also lead to radiating pain. Okay, into your right shoulder. Okay, if the patient comes to you complaining of right upper abdomen pain and right shoulder pain, along with nausea, vomiting, okay, tenderness in that area, fever is there, then you should think about cholecystitis. Uh, Positive Murphy sign. I'll show you what is Murphy sign. So patient can't take a deep breath when the examiner's hand is passing below the hepatic margin because of the pain. So whenever the patient tries to breathe air in, there is excessive pain because of the stretch. Okay. Chronic cholecystitis में क्या होता है? Chronic मतलब it is not acute. It has been there for more than 3 months. It occurs because of insufficient emptying of this gallbladder and the gallbladder muscle wall disease. So you can see here, this is the gallbladder, this is the cystic duct, this is right and left hepatic duct forming common hepatic duct, cystic duct opening forming common bile duct. ये common bile duct यहाँ side से you're getting pancreatic duct. So any kind of stones which come and sit inside this common bile duct or cystic duct can cause obstruction leading to cholecystitis in this area especially. Okay. This is how the stones look like. See how much of stones are you're seeing in that gallbladder. Hmm? This is Murphy's sign. You're making the patient sleep. ठीक है? यहाँ पे is your rib cage. This is where your rib cage is ending. You try to insinuate or you try to push your fingers. You try to palpate the hepatic margin. Last margin of the liver, now you can feel it whenever the patient is trying to breathe in. Because once you breathe in, lungs expand. It pushes the diaphragm down. It pushes the liver down. So whenever the liver gets pushed down, you can feel the liver going below it. But he's not able to do the inspiration here because that is eliciting pain. That is Murphy's sign positive. You see it in cholecystitis. Then you have acalculous cholecystitis. Calculus means stone. Acalculus means there is no stone involved. It occurs in absence of gallstones and it is caused by bacterial infection via lymphatic from lymph or it can come from any kind of vascular system. In that, these people will pass dark orange foamy. Foamy matlab lathery. Okay, lather रहता. Sabuni, lower soap water. How you see lather, that kind of a urine will come. And it will be dark orange in color. Steatoria can be there because all this bile is not being excreted into the duodenum, right? That all that fat which you're eating is not getting digested. So what happens? All that I told you, na, that light yellowish color which floats in the liquid, floats in the water, fat excess, fecal matter is called steatoria. Also, you can have clay colored stool because bile is not getting produced into the duodenum. So the urobilinogen is unable to cause any kind of coloration to the fecal matter. Okay, that can cause clay colored stool. Pruritus can be there. Any kind of jaundice, if jaundice occurs, or any kind of accumulation occurs, वो जगह पे you can develop pruritus. Jaundice is also itchy. Just remember that our own blood, if it ends up, it is supposed to keep flowing. But if it doesn't flow and there is stasis, that area will have excess amount of itching. Excess itching is nothing but pruritus. Okay, our own blood is feels like an allergic condition. It causes an allergic like condition for us. Okay, so blood is always supposed to keep moving, but not. It is not. It is never supposed to be stagnant. Management is anticholinergic. Will give to decrease that spasm of the duct wall. Okay, so bile duct is there. अच्छा spasm में चले गया. Okay, because of the stone or if there is any kind of problem, you have to release that spasm. You will make the bile duct wall become more loose, so that that bile can flow out. You're giving an anticholinergic. Analgesics you're giving to control the pain. Gallbladder stones are removed surgically if the pain persists. So most of the gallstones, especially if it is in the duct, will lead into surgeries. If it is in the gallbladder, you can give some medications and decrease the size of it. But if it is in the duct, mostly they'll end up into surgeries. You have to remove it. You have to remove the whole gallbladder. That surgery is nothing but cholecystectomy. Ectomy is removal. Surgical procedure of removing the gallbladder. And choledocholithotomy. Lithotomy is stone. Okay, you're removing that stone. You'll cause a small nick opening into the common bile duct, or wahan se you'll remove that stone, which is if you have the stone in the common bile duct. Okay, that is called choledocholithotomy. Again, coming back to stages of shock, we have learned types of shock, 4 types, na? And then coming to stages. First, what happens? Initial stage, mein kya hota hai? Everything happens very quickly. Okay, so it's an acute attack. Initial stage में क्या होता है? You have decreased cardiac output. Whatever the output which is coming out of the heart is not sufficient, which results in reduced mean arterial pressure. The pressure in that artery, aorta, will reduce. Increase in the heart rate. So whenever the pressure reduces, the heart will try to compensate by increasing, by pushing more. Whenever it's trying to push more, na, the heart rate will increase. The patient will have tachycardia. Okay, due to stimulation of the sympathetic nervous system, which is characterized by increased heart rate, decreased blood pressure, patient will have thirst, patient will look pale, cool, moist skin, okay, so sweat hote rehta, and all the peripheries will all be cold, especially on the face. Compensatory stage, second stage, यहाँ पे what is happening? Stimulation of the sympathetic nervous system releases epinephrine and non-epinephrine. Two hormones are released. They will try to maintain the homeostasis. They'll try to maintain that balance. Peripheral vasoconstriction causes stimulation. Uh, Whenever the peripheries undergo vasoconstriction, it causes stimulation of alpha adrenergic fibers, which assures that more blood is available for हार्ट एंड ब्रेन. मतलब पेरिफेरल एरिया में vasoconstriction होके मेन एरिया को ब्लड द ब्रेन एंड द हार्ट नीड्स टू रिसीव मोर ब्लड. So all the vasoconstriction in the peripheries will improve the blood supply towards the brain and the heart. This is what happens whenever there is alpha adrenergic fiber stimulation. Then what happens? Beta adrenergic is stimulated. इसमें क्या होता है? Coronary. Coronary मतलब which is going to the heart walls. Cerebral मतलब which is going to the brain. Coronary and cerebral artery dilatation occurs due to stimulation of beta adrenergic. So vasoconstriction is causing alpha adrenergic. अल्फा adrenergic की वजह से vasoconstriction हो रहा है पेरिफेरी में. बट बीटा adrenergic की वजह से क्या हो रहा है? मेजर आर्टरीज आर गेटिंग डायलेटेड ताकि increased amount of blood flow goes towards the heart and the brain. This results in increased cardiac output. Increased जब and इसके साथ साथ even the sodium and the water can be reabsorbed, which also results in increased cardiac output. Progressive stage. Finally, the compensatory mechanism becomes ineffective. Okay, it has tried to maintain homeostasis till now, but finally it says I cannot do it anymore. That is the progressive stage. Impaired perfusion will result. That will cause anaerobic metabolism and cellular hypoxia. Anaerobic metabolism matlab there's no oxygen. Okay, cellular hypoxia occurs. Renal ischemia stimulates. Even the kidney is not having any amount of good supply. The major focus is on the heart and the brain. So kidney maar khayega. Kidney, what will happen? Renin, whenever kidney is undergoing any kind of damage, there is something called renin angiotensin aldosterone system which is getting activated, which causes further vasoconstriction. Okay. Then there is something called irreversible stage. Irreversible, the name itself says you cannot reverse it. All the compensatory mechanisms will become ineffective completely. And coronary cerebral tissue also, the perfusion drops. Up tak they have tried to maintain the perfusion or the good amount of blood supply towards the brain and heart. But in the last stage, irreversible stage, mein, even the heart and brain are succumbing and organ systems completely fail. That's what they'll go into complete shock. These are the stages. Next, jumping to Wilson's. Another 15 minutes, we'll be finishing off this complete PPT. Either tomorrow or day after, we'll have one more class, fresh PPT. I think sir told me that there are 600 slides. We've finished almost 400. So just few more left, we'll be doing it. Okay. So Wilson's disease. Wilson's disease is nothing but copper excess. If there is copper excess in the body, it will get deposited in various organs. And especially one area very clearly where you can see is your cornea. The ring around that cornea, this black thing you can see, and the white thing which is your sclera. Between that, you'll have a nice brown color ring, copper ring रहता है. उसको बोलते हैं Kehr-Fleischer ring. Okay, that is one of the indications for us to say this person is having Wilson's disease. So it's a disorder of copper metabolism characterized by deposition of copper in liver, brain, and other tissues, known as hepatolenticular degeneration. Copper gets deposited in basal ganglia. Basal ganglia is a part of the brain, leading to tremors, choria's dancing like movements. If you have never seen a chorea patient, it's very sad. You have to go see chorea patient. It's very sad how they have no control on their hands and their legs. They keep dancing. They can't control that movement at all. ऐसे रहता है, how I'm showing you. Okay? And poor thing, they'll start crying when you tell them why is it happening. If you have not seen, at least see some YouTube videos. Korea करके डाल के see Huntington's Korea. Then there's something called dystonia and rigidity. All these things occur whenever the basal ganglia is getting damaged. Then you have Kehr-Fischer's rings, brownish color on the sclerocorneal junction, just around this black area. Other than that, under in the lens, the lens can undergo sunflower cataract. Sunflower की तरह ही दिखता. Okay. Management is lifelong. You have to give them zinc or penicillamine, triantine. All these are all antidotes, okay, for copper excess. Ammonium tetra, ammonium tetrathiomolybdate is a chelating agent. It will remove excess amount of copper from the body. It's an initial treatment. Uske baad we'll put the patient on penicillamine. It's an antidote. So you can see this brown ring around the cornea sclera junction. This brown ring is called Kehr-Fischer ring. Okay, you see this in the Wilson's disease. There's a lot you can see. This is one of the most common things. Okay, next jumping into morphine. Morphine, everybody knows it was used as a pain management long ago. Even HP use karte for severe pain management. Severe pain mein hai to you can give morphine. Morphine causes spasm of sphincterophory. Where is sphincterophory? It's near the ampulla of Vater. So it is contraindicated in patients with cholecystitis and pancreatitis because the common bile duct and pancreatic duct are opening in the ampulla of Vater. So if they have any kind of gallbladder issues or the duct issues or any kind of pancreas issues, that sphincterophory will undergo spasm if they're taking morphine. So you'll avoid morphine if they have cholecystitis and pancreatitis. Then elevated serum amylase and serum lipase indicates there is pancreatitis. There's something called Cullen sign and there's something called Gray Turner's sign. It's a discoloration. It's a bluish, purpley discoloration. If it occurs around the umbilicus, around the belly button, periumbilical, it's called Cullen's. But if it occurs in the flank area, जहाँ पे आपका कमर, the shape of that कमर comes, at the abdomen area, at the lateral borders, or in the lumbar regions. That is where you call it as Gray Turner's sign. Same discoloration, and these both are seen in pancreatitis. So figure A is Cullen sign. It is happening periumbilical, around the umbilicus. Gray Turner's is on the side, in the flank region. Okay, both are seen in pancreatitis. This is incisors. First two teeth up, first two teeth down, center. Okay, center and lateral incisors. Just remember that incisors teeth say if you try to see the length, okay, till the top of the stomach, kitna length hai? In males, it is 38 to 40 centimeters. The distance between the incisors teeth to the top of the stomach is 38 to 40 centimeters in men and 36 to 38 centimeters in women. The these are all like whatever we have read till now, it's just one liners, okay? The microorganisms closely associated with dental cavities. Remember, it's Streptococcus sanguis. Streptococcus sanguis. Parotid is the largest salivary gland. Submaxillary has the longest duct, salivary duct. Okay. Glossitis is inflammation of the tongue. Inflammation of the mouth is called stomatitis. Iron absorption occurs in duodenum. Leiomyoma is the most common type of benign, not carcinoma. Benign esophageal tumor. Most commonest type is leiomyoma. Adenocarcinoma is the most common type of malignant tumor of the esophagus. What is the strongest layer of gut? It is the submucosa. Most innermost layer is your mucosa. And just after it is your submucosa. Cecum. Cecum is the thinnest. I'm reading this. I'll show you where all these parts are. Yesterday also I showed you, but today also I've copied that picture here. Cecum, the first part from where the intestine starts. Okay, from the right side. Okay, it's the thinnest muscular wall. Has thinnest muscular wall, but it is most because it is thin. It is most vulnerable for perforation, and it is least vulnerable for obstruction because काफी spacious रहता है ना. So obstruction is very rare, but it can undergo perforation. Hole can fall. Cecum is the widest portion of the colon. Narrowest part of the large intestine is the sigmoid colon, which is on the left side. Sigmoid, an S shape, just before the rectum. Ascending colon is the shortest part of your colon. Area of colon, which is least visualized, is your sigmoid colon. So you can see this yellow part. यहाँ पे yellow part जो है cecum. This is most thinnest part, most spacious part. So obstruction doesn't occur, but perforation can occur. Ascending colon is the shortest part of your large intestine. Okay. Sigmoid colon is the least visualized. Okay. And one more thing is, it is also the large intestine, but its most spacious part is your cecum. First organ to be affected in carcinoma stomach is liver. Liver मार खाता है CA stomach में. And which is the organism responsible for carcinoma in stomach? It's the H. pylori, Helicobacter pylori. It's the risk factor for intestinal type of CA stomach. In Helicobacter pylori, you will do a urea breath test, hydrogen breath test, detect the presence of this H. pylori. Cullenson, I already told you, it is seen in hemorrhagic pancreatitis. Mirizi syndrome. There is something called Mirizi syndrome. Mirizi syndrome matlab gallstone jo hai na, it will get impacted. It will get stuck in the cystic duct. Cystic duct is coming just outside the gallbladder, or it can get stuck at the neck of the gallbladder, and it can cause compression of the common bile duct. It is called Mirizi syndrome. Usually, these cases they will undergo cholecystectomy, that is removal. Hematemesis is nothing but blood in the vomiting. SGOT, SGPT, AST, ALT, all these are liver enzymes which you see in LFT. You will measure the ratio. If SGOT is more than SGPT, that ratio, if it is more than 3:1, it is suggestive of alcoholic liver disease. And if AST is more than ALT, it is suggestive of cirrhosis. In alcoholic dependence and abuse, you ask the questions to the alcoholic patient. It is called cage questionnaire. I'll show you what it means. Just remember this. Normal portal vein pressure is 5 to 10 mm Hg or 10 to 15 centimeters of water. Ground glass, matlab pink hepatocytes are seen in chronic viral hepatitis. This is cage questionnaire. C matlab, you'll ask the patient, have you felt the need to cut down? A matlab, have you felt annoyed at the suggestion that you might have an alcoholic problem? G matlab, have you felt guilty about excessive drinking? E, do you need an eye opener in the morning? So all this, if the patient has a positive response, if the patient says yes, okay, score 1, you'll give 1 for each positive response. Score of 2 or more, this suggests an alcoholic dependence problem. Wilson's again is a disorder of copper metabolism. Copper. Okay, iron. If he asks you about iron, then it is hemochromatosis. Wilson's is copper. Hemochromatosis is iron. Then there's something called waist circumference and hip circumference. You try to measure and you cause a ratio. That waist to hip circumference ratio should be less than 0.8 for you to call that patient as normal. But if it is great, it is more, it implies that they have high risk of obesity. Then I told you about Curling's ulcer. Curling's ulcer is a complication of a burn, which is acidic burn. It's a type of gastroduodenal ulcer caused by stress, resulting in decreased production of mucus and increased production of acid. Then, when you do a parenteral nutrition, you place a catheter in the subclavian vein. Subclavian vein is just at your SVC level, okay, superior vena cava level. Just outside, after the superior vena cava comes, na, just outside you have a subclavian vein. So, wo jagah mein you'll put your catheter for parenteral nutrition. I'll show you a picture. What is the complication of gastroesophageal reflux disease? I told you there's a change of epithelium from squamous to columnar. That's a Barrett's esophagus. And this Barrett's esophagus can undergo further change leading into carcinoma, adenocarcinoma of esophagus. And Barrett's esophagus is a precancerous lesion. Distended abdomen, or this means it has increased in size, and absence of bowel sounds after surgery indicates that paralytic ileus. So after surgery, you will check for bowel sounds. Now, if you are not able to hear, it means it's paralytic ileus. Usually, after 6 to 7 hours, you're supposed to hear, or at least after 12 hours, you're supposed to hear the bowel sounds. There's something called fundoplications. I told you. It's a surgical procedure which is done in GERD. You will wrap the stomach around the lower esophageal sphincter. Halitosis is the foul smell coming out because of any kind of diverticulum. Okay. What is McBurney's point? If you draw a line from the umbilicus to the anterior superior iliac spine, 2/3 from the umbilicus or 1/3 from the anterior superior iliac spine of the pelvis, that point on the right side, right lower quadrant, is called your McBurney's point. And that's where you'll develop rebound tenderness in appendicitis. So see, you can see this pink area. This is your clavicle. Below it you have a subclavian vein. तो इसमें है ना वो catheter डालते हैं. So directly it enters into your circulation. Okay. This is your superior vena cava and this is your branch of it, which is subclavian vein. So that is where you're putting your central cath. Okay. You have seen many of the patients in ICU having that cath. Okay. This is done by anesthetist. Heartburn, regurgitation, and dysphagia are classical signs of GERD. जोलिंगर एलिसन सिंड्रोम करके एक है, उसमें एक ट्रायड रहता है. ट्रायड मतलब कॉम्बिनेशन ऑफ थ्री थिंग्स. फर्स्ट थिंग इज it is a rare condition. It is characterized by first thing is severe peptic ulceration. You have peptic ulcer. Second is hypersecretion of the gastric acid. Okay, you'll have elevation of gastric levels. And third thing is gastrinoma, tumor of pancreas. Okay, antacid is what which neutralizes the HCl secreted in the stomach. Billroth 1, I've already told you, you're removing one part of the stomach and the remaining part of the stomach is getting connected to the duodenum. That is Billroth 1. Billroth 2 में क्या कर रहे हो? You're connecting that remaining part of the stomach to jejunum. That's Billroth 2. This is the triad of Zollinger-Ellison. Okay, gastrinoma, gastric hypersecretion, and peptic ulcer. Zollinger-Ellison syndrome. Then there's something called pernicious anemia. B12 deficiency, intrinsic factor deficiency leads to improper absorption of B12 leading to megalocytic or macrocytic anemia, which is nothing but pernicious anemia. It is because of deficiency of intrinsic factor. It's also a long-term complication of total gastrectomy. That antrum part, that niche ka part before the pylorus, you're removing it off. Now that is very rich in parietal cells. And parietal cells ka function kya hai? To release intrinsic factor. If you're removing that part, intrinsic factor deficiency occurs. No? Inflammatory bowel disease, two types, Crohn's, ulcerative colitis. Ulcerative colitis involves colon and rectum. Crohn's can occur anywhere in your GI system. Okay. And ulcerative colitis is more responsible for causing colonic cancers. Crohn's disease involves all layer, okay, can occur anywhere in the GI tract, but ulcerative colitis occurs in your submucosal layer, in the colon and rectum. What is hematochezia? I told you frank, red, fresh blood coming through the rectum into the fecal matter is called hematochezia, passing blood in the feces. Melena is happening because of upper GI bleed. एकड़ो bleeding आएंगी, फिर बाद में आ रहा है वो तो blood will become blackish brownish ना, dark, tarry, sticky stools. Is nothing but occult blood, Purana blood. That is melena. Oral erythromycin and neomycin. They are the antibiotics which are given before the gastric surgery to reduce the number of bacteria and to prevent post-operative complication. Then barium enema. Name में ये enema means you're giving it from down. This is to determine the narrowing or any kind of obstruction in the colonic liquid. Okay. Clinical manifestation of fat malabsorption. I told you fat, if it doesn't get digested, all that fat which is let out in the fecal matter is called steatorrhea. It is bulky, foul-smelling, yellow, grey, greasy stool with putty-like consistency. Celiac disease is treated with lifelong avoidance of dietary gluten. Okay. Celiac's proof. They are allergic to gluten, gluten-free diet. Okay. Hallmark of Wilson's is that corneal case of Fisher ring. Grey Turner Cullens are that discoloration. Cullens is around the umbilicus. Grey Turner is in your flanks. Both are seen in pancreatitis. Whipple's procedure. It means radical pancreatico-duodenectomy. Pancreas and duodenum both are removed. It's a classical surgery for pancreatic cancer. Rapid removal of fluids from abdominal cavity during paracentesis leads to decreased abdominal pressure, which can cause dilatation, vasodilatation, and shock. So you have to go gradually. In case of any kind of airway obstruction, tube needs to be cut. So scissors are keeping, and that's instant click more. If it causes any kind of obstruction at the oropharynx level, you keep a scissors at the bedside so that you can cut and relieve that pressure. Patient receiving lactulose, it's because for the management of hepatic encephalopathy and coma. You have to monitor them closely because after some time, even lactulose excess can cause watery stools. Okay, if that watery stools is coming out, it means you're giving too much of lactulose. You need to reduce the dose. Then hepatitis B, I told you it's a DNA virus and remaining all are RNA virus. Murphy's sign, I told you, the examiner is trying to insinuate his fingers or trying to touch the lower border of the liver. And whenever the patient, you tell the patient to inspire air, he's unable to do it because of excessive pain. and this is seen in cholecystitis. Adhesion, I told you, it's a union of two opposing tissues. If it has undergone any kind of an ulceration or any kind of kuch mark hai, inflammation hua hai, infection hua hai, it will heal by fibrosis and it will end up having some kind of connections between two. It can happen intraluminally or it can happen even outside between two lumens, and it's especially one of the causes for intestinal obstruction. Okay, guys, thank you so much. Yes, answer. Okay, Dalia. Dalia, thank you so much for joining, and also the remaining three members, other than Dalia, who have joined. Thank you so much for joining. Have a nice day, guys. Thank you for giving me your time today. So, regarding tomorrow's class, I'll inform you in the morning. Okay. Take care, guys. Have a nice day. Thank you so much. Bye.